Hello everyone, my name is Christina and I am a dental hygiene student. Today I'm going to teach you how to properly brush and floss your teeth. To start with, I am going to demonstrate with a manual toothbrush. So what you want to do is first you want to just grab the toothbrush, put it against your teeth, and angle it at a 45-degree angle towards the gum line. From there, you're just going to go brush in a circular motion, making sure you're slightly overlapping with the gum line for the outside surfaces. For the inside surfaces, you would make sure you get into these little grooves. Then for the inside, again, using a circular motion to grab. For any of the front teeth on the inside, I do recommend brushing in a vertical or up and down motion to get out those grooves. Next, I'm going to demonstrate with the electric toothbrush. It's not that much different. You would do the same. You would just angle it again 45 degrees, except you will hold it against the tooth surface for 1 to 2 seconds. And then it will go ahead and do the vibrations all the way out. Same with the occlusal surfaces. Another neat cool thing is to tell you if you're brushing too hard, and red is if you're pushing too much. And to end off all the brushing, don't forget to brush that tongue. Either with the manual toothbrush or the electric toothbrush. Okay, and after brushing, we're going to go into flossing next. I like to do is grab 12 to 18 inches of floss, and then I would like to wrap it around my middle fingers here, and then leave 3 centimeters space so I can push down with my pointer finger. So what you want to do here is start by going down gently along the teeth and then hug the tooth as close as possible. You can go about 1 or 2 millimeters underneath the gum line here. And once you're hugging the tooth very strongly to a C shape here, what you're going to do is you're going to go pull up to pull out any gunk. You're going to do this the same on the other side. You're going to go down, hug the tooth as close as possible in the C shape, and then you're going to go ahead and pull up. And you can do this for back teeth as well. You're just going to go in, hug the tooth as close as possible into a C shape, and then you can go up and down, left or right, to dislodge any gunk and then get out. And then as you're moving along the tube, make sure you move about 1 centimeter away from the position you just used so that you are not reintroducing old gunk into these new spaces. For those who are having trouble with the string floss here, I also do recommend using these little Floss Picks here. They work just as well. You can go hug the side of the tooth and then pull up, going in, again, making sure you can go underneath the gum line, hugging as close as possible, and then pull out. Another cool little gadget for flossing here would be the little interproximal brushes. For here, you can go for this, usually very well for getting interproximally. I would usually use it for like maybe prostheses of any sort, or if you have braces, these are good appliances to help with the flossing for these. Another good interdental aid would probably be the water flosser. For there, you can just go on to your teeth, just angle it at about a 45-degree angle, and you can start with low pressure first to push out any gunk in between the teeth. And then as you gradually, you can increase pressure as needed to get anything. But do not do full pressure straight along the gum line. That will be damaging. And that's all for brushing and flossing today. Well, the last step I usually like to do to end the routine is use a mouthwash of some sort. Here's just an example. This is active with fluoride. What this does is it leaves your teeth feeling nice, fresh, and clean. And then it also provides a protective coating for the rest of the day. Alrighty, and that's all for today. For more tips and tricks, please see any of the other videos. Thank you. Until next time.